Hello, everyone. Howard University has recently joined the Data for Health initiative to provide technical expertise in the area of medical legal death investigation systems, which I will call MLDI systems throughout this video. This umbrella term is used to describe coroner, medical examiner, police-led, or hybrid systems which examine unnatural deaths. In this video, I'm going to introduce the work that the Howard team will support collaboratively with government agencies and Data for Health partners. But before I focus on this topic, I would like to take a step back and look at the bigger picture of the Data for Health initiative. As you may already know, the Data for Health initiative works with countries, directly with governments, to improve public health data and its use for policymaking. In other words, the aim is for countries to use data for action or data for health. One component of the initiative focuses on strengthening civil registration and vital statistics systems, or CRVS systems, which are quite complex. Data for Health supports various approaches to strengthening CRVS systems for the registration of births, stillbirths, and deaths, and for the reporting of cause of death data. This is what we're going to look at more closely, cause of death data, to understand the role of Howard University in the initiative. In these figures, you can see the composition of causes of death by country income groups: low, lower middle, upper middle, and high income. We see injuries in yellow being only a percentage across all income groups. Communicable diseases are in purple, and non-communicable diseases are in green. These figures are a visual presentation of cause of death statistics that come from many, many data points. I imagine all of you are quite familiar with the source of these data points, the medical certificate of cause of death. You can see the WHO recommended form from 2016 and two actual forms which clearly show, even without reading the detail, that reporting practices may impact the quality of cause of death data. Improving the quality of cause of death data has been a key intervention area in the Data for Health initiative. We have supported the training of doctors in certifying correctly, mapping and improving systems processes, and designing and implementing eMCCD platforms. These are just some examples. In the initial phases of Data for Health, these interventions really focused on natural deaths, those from communicable and non-communicable diseases. If we focus on natural deaths, we overlook deaths from injuries. These can be suicides, homicides, accidents, or unknown manners of death. Although these deaths are a smaller percentage among total deaths, the critical point is that a majority of these deaths are preventable through the implementation of strategies, policies, and programs, such as these strategies focused on preventing deaths from road traffic crashes and drowning. For this reason, we have put more attention in Data for Health to strengthening MLDI systems as they relate to CRVS systems. Many interventions used in Data for Health that have been used to improve the quality of cause of death for natural deaths can be used to improve the quality of cause of medical legal deaths, but we have seen a need for modified approaches as well. For example, in CRVS work, we often engage with three core stakeholders: civil registration, statistics, and health. We can present this as a three-legged stool. With MLDI systems, there are many more stakeholders, so just think about it for a moment. Who would you add as another leg to the stool? Maybe you would consider police, the Ministry of Justice or Interior, laboratories, funeral homes, and potentially many others. The Dominican Republic has an 11-legged stool for the various stakeholders in the MLDI system and CRVS system. Although we can use comparable tools as those already used to improve quality of cause of natural deaths, we also need to consider some variations or new tools just because of differences between systems that focus on natural versus unnatural deaths. This is how Howard University became a partner in the Data for Health initiative. Based in the Department of Pathology at the College of Medicine, the Howard team aims to support best practices in medical legal death investigations globally. We will do this by collaborating with countries and Data for Health partners and implementing solutions with sustainability in mind. Our work aims to assess and strengthen MLDI systems, which we will do through three main areas: the review and revision of laws, assessment of systems, processes, and standards, and the assessment of needs of individuals to build their capacity and good practice standards. Let me share just a few examples of the work that we will do in these three main areas. For assessing and strengthening laws, we will collaborate with our partner, Global Health Advocacy Incubator, to support country lawyers in the review of the country's MLDI legal framework by using the MLDI module and the CRVS ID Legal and Regulatory Review Toolkit. This module has been used for targeted legal reviews in various countries, including Belize, where a new law has been drafted and is under review in Parliament. At the systems level, we support various interventions, such as the MLDI landscape analysis, which was developed in Phase 5 and piloted in 5 countries with differing MLDI system types and levels of system maturity across Africa, Asia, and the Pacific. The MLDI landscape analysis is based on a questionnaire that gathers information on the MLDI system across 7 core domains to understand the current system as compared to good practices. Papua New Guinea, Mozambique, and Rwanda are now embarking on the systems improvements in Phase 6 that were identified through this assessment. Another systems assessment method we use is business process mapping, which is an excellent method for bringing stakeholders together to develop a clear understanding of a system process and potential areas for improvement. At the individual level, we will train doctors in autopsy standards, general medical legal death investigation, and correct completion of MCCD forms. We have seen that skills in examining decedents in a standardized and thorough format, coupled with good MCCD reporting standards, are key for good quality cause of death data. Good quality cause of death data coming from MLDI systems can prevent premature deaths. As you can see in this figure, as seatbelt use increased, deaths of passengers not wearing seatbelts decreased. This figure is a visual representation of data for health. Policies can be very impactful in preventing premature deaths, but we need good quality data to know who is dying, from what, and where. This is the reason for Howard University to join the Data for Health initiative. We are very excited to collaborate with partners and government agencies to assess and strengthen MLDI systems and their connection with CRVS systems through the review and revision of laws, assessment of systems, processes, and standards, and the assessment of needs of individuals to build their capacity in good practice standards. Let me wrap it up here for now. Thank you so much for watching this video.